Welcome back to Tales of Truth, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is my nurse, JoJo. And today we're going to talk about heartworm disease. But first, JoJo and I haven't seen each other in what feels like weeks. We are in the middle of the summer, and we both have children, and we feel like we're long lost coworkers. Even though we probably communicate most every day, I haven't seen your face in
That's
weeks.
true. I actually heard your voice.
And just short texts and emails.
So we are recording this early morning hours before the families rise.
Mm-hmm. Yeah, we got up early to hang out.
With makeup on, which is not, that is not a daily for us. But we're
There's
here to talk to you
mascara.
about heartworm because that matters. It
It really
to
does.
us.
And we have some hot takes.
Yeah, you have I've wanted to talk about this because you have a particular take that I've not heard in any other practice I've ever worked in.
I know, and I don't get it. And I have a little anxiety that some other veterinary professional is going to like school me with some information I don't have, but I don't think that's true. But should we just get right to the hot take? And then we'll talk about heartworm disease in general.
Let's get the big.
Let's just get to it.
Let's just open it.
So if you have a dog or cat, because we can talk about cats and heartworm disease too, your veterinarian probably makes a really big deal about testing before they give you new prevention. So, we can give you prevention for a year. Most clinics require a new test every single year. And then there's even like, wait for us to get this test back before you give any prevention. We'll call you, or if we don't call you, you can give prevention, but wait X amount of time. And I don't understand this because when dogs turn positive, one of the ways we treat them is with the preventative medicine. And so I don't understand this obsession of not being able to dispense a new prescription without a heartworm test. And it's not that I don't understand why we heartworm test, because we need to make sure our prevention's working and we need to know that status. But it's not necessarily so we can give prevention. And that's the piece I don't understand. And it annoys me.
Yeah, so how do you navigate it differently?
Well, I don't require heartworm tests to dispense prevention. It's kind of like telling somebody, I don't know if I can find a good analogy, but I always think of it as like dispensing contraceptives to teenagers. It's like, just give it to them. Like, if you want to prevent this disease, heartworm disease, then dispense the prevention easily. Make it easy. And I do think we should do testing. So when someone comes into my exam room and they're like, I'm not going to test, I still dispense the prevention because I really don't want that dog getting heartworm disease. Now, I also live in a place, Boulder County, in the 18 years I've been here, I've seen one heartworm positive dog that I swear got it traveling somewhere else.
I was just going to say that dog probably was not born and stayed in this region.
Exactly. So
yeah,
I don't see a lot of heartworm positive cases. And so maybe a veterinarian practicing in Mississippi is going to listen to this and be like, oh my gosh, what is her problem? But I just don't understand how rigid we get about it, because there are some moments that I would like to use that money for something else. If someone's financially restricted and I can either do a vaccine that I want to do or something else that I want to do, or, do blood work or something else that feels more important than that heartworm test, the hang up on the heartworm test, or the other thing, if I have a really scared, maybe sometimes fear-aggressive dog, I might not choose to have a blood draw be the battle of the day. So anyways, but I will still dispense heartworm prevention because I want that dog to be protected.
Well, it makes so much logical sense to tack on a heartworm test if you're already doing blood work.
Yes.
just, I mean, it's financially pretty insignificant to add that on, but to
Yes.
do one solo for the purpose, solo, yeah, for the purpose of dispensing heartworm,
Yeah.
that feels different.
Yeah. So that's I don't understand it. It's universal. It's every clinic. And I really do want to know my patient's heartworm status. I want to know it for so many reasons, for their cardiovascular health, before anesthesia. It's not that I think heartworm testing is silly. I just don't understand the correlation. And people get irritated with us when we won't dispense without a heartworm test. And so that's why I love working at Boulder's Natural Animal, is because I can be reasonable and case by case. Like some people are like, why do I need to do a heartworm test when I give my dog prevention year round? Which we should talk about seasonal versus year round
Yeah, but
prevention.
I was gonna say that's another hot topic that you walk around with.
Yes, yes. And so when people push back, I just don't have a good reason to make them do it. And so I will be like, well, let's do it every other year. So for people that are on giving their dog prevention all year round in Colorado, in Boulder County, I just want to be really specific about that, because if you live in Florida, like none of this applies to you. I'm totally fine testing every other year, because I think what they're saying is reasonable. You're like, well, why would I? Where's my prize for doing year-round prevention in a place with a complete winter season?
Well, and in veterinary medicine, I think we've done a good job of getting that message to the people, because the average customer comes in, or the average pet parent comes in knowing they need their heartworm test. It's something that we have trained pet
Yes.
people to know it's needed. And so I think sometimes when they have moved to Colorado, or they're living in Colorado and they meet you, it's just, there's a whole educational unlearning
Yes.
that has to take place for them to understand why they don't have to have the heartworm test. So maybe start there. What would, if somebody came in and
Well,
they've done prevention?
okay. So there are a few. Well, okay. First of all, we'll get to the point here. But
Yeah.
in Colorado, like if you're in Boulder, Colorado, your dog can't get heartworm prevention when there are no mosquitoes. And our mosquito season is roughly June to September. Every once in a while in May, we might have a warm month. But for the most part, it's June through September. And sometimes we even have snow at the beginning of September. So sometimes it's even less than that. And so if there are no mosquitoes, your dog or cat cannot get heartworm disease. That's how it's transmitted. They can't get it otherwise. A lot of veterinarians here will push for year-round prevention. And the reason why they do that is if you travel with your pet and forget about it, like if you're like, oh, I'm going to make a quick trip down to Texas, Oklahoma, wherever, go, travel up and down the West Coast, then that's problematic because people forget about it. So veterinarians here are like, I just want it on the first of every month, no matter what. And that makes sense to me.
That's a good
But
habit.
It's a good habit. And I work for a lot of people that probably could use that habit because they have so many things going on in their life. And we even remember the dog in our practice that became heartworm positive because they traveled. And so I think I understand that. The other reason is that heartworm prevention also protects from intestinal parasites, which can be transmitted to people, certain intestinal parasites. So a lot of veterinarians feel like if there's kids in the house, I just want to make sure we're covered. I think that's a little excessive. As we experience global warming, we do see more intestinal parasites in this area, but still not in the winter and not as much as you would think. And so veterinarians have a good reason for doing that, but I do think it's a little excessive.
I mean, I will own that I only heart guard. I only prevent in the summer months.
Yes.
That's all I do. I just have it on my phone to remind me, oh, it's time to start.
Yeah.
And then I just base it on, okay, how's our weather changing? But I actually haven't seen a mosquito this year. Which
You haven't?
I haven't.
Nice.
Yeah,
Nice.
I know.
see.
But I'm still preventing.
Yes. Well, I think that that is totally fine. And a few years ago, so when I had my pug, I hardly ever did heartworm prevention because I just don't think the odds of getting heartworm disease in Boulder County are high enough to matter. Now, what I'm telling my clients is that I think it's possible that could change because we are warming up and because we're seeing different parasites and the flora and fauna are changing and the types of mosquitoes that we could have here are going to be different and maybe they can live longer. So as I understand right now, not only do we not have in Boulder County specifically, and I'm only going to talk about Boulder County because the minute you go down in elevation, everything changes. And I mean, I think difference, like if Pueblo, Colorado could have a completely different fauna than we have here. So we don't have the correct mosquito to transmit heartworm disease. And I don't know if this is true or not, but this is a personal theory. I don't think the mosquitoes live long enough to bite an infected dog, have the heartworm larva mature, and then be able to bite another dog and infect them.
Yeah,
and so
talk
I think
about that. Talk about the life cycle so that people understand what the life cycle of the heart.
okay, first of all, I have to get the cat on my lap because he's going to scratch me. Hold on.
Okay.
Come here, Ritz.
Well, here, I'll keep talking while you do that.
Okay, he's okay.
Well, because I
good.
also have this theory of, and maybe this is not true either. This is just made up in my own head. But I wonder if we will see a heavier load of heartworm positive dogs as kennels and breeders or I guess it's the like humane societies are moving dogs from areas. So as we get Texas dogs and New Mexico dogs here for adoption, do we increase the risk of, well, the mosquito? I guess, I'm like, the mosquito still has to be with it.
And that's what veterinarians always tell clients, like, oh, we have all these heartworm positive dogs coming in from other states. But I don't think, I mean, we have had that for decades.
Yeah.
Decades. And so
we actually need the mosquito is the key component to this.
Yeah.
It's not the positive dogs.
It's not the positive dogs. And if someone wants to tell me how wrong I am, please do that. But I mean, I've been here for 18 years and I have had one heartworm positive dog. I mean, and I do heartworm tests all day long. That's probably number one test. And so it's like we still do it. And the reason why we do test, so if you live in another state, oh my gosh, all the cats are coming. If you live in another state, the reason why we test is because heartworm prevention can fail. And so veterinarians are not just trying to make money. We're really trying to make sure that one, did the prevention fail? And it's really important to know the heartworm status of your dog. And so in no way do I think heartworm tests aren't important. I just think it's strange that we are, I've got a tail right in my face. I just think it's strange that we're withholding prevention based off of a heartworm test.
Yeah, I think that's fair.
And I just want to say one more thing. If you're trying to be integrative, natural, less chemicals, preventing heartworm disease is like one of the least toxic things that you can do because it's just ivermectin. It's this microdose of ivermectin and it's in and out of your dog's system in like 48 hours. It's not there for long. I don't worry about it. But if your dog gets heartworm disease, the treatment for that is oh so toxic. It is an arsenic derivative. And while I still support doing it, your dog does not need to have heartworm disease. It's so much easier to prevent it. So for those of you that are worried about, toxic prevention, preventing heartworm disease is just not one of those.
Right. Your risk of toxicity is much lower on doing annual or monthly.
It's like zero. It is. Ivermectin is one of the most studied, safest drugs. And you're not even using like a therapeutic dose. It's like a micro whisper dose. It's so small that dogs like collies that have a gene that makes them sensitive to ivermectin can still take it. That's how small it is. So
I was going to ask actually specifically about that. There is a there's a phrase, and I can never remember it, about, oh, maybe that's with
White feet don't treat.
Yeah, that's the one. Okay. I can never remember it for some reason. It should stick, right? It's meant to stick.
Yeah.
Doesn't stick. White feet don't treat
Yeah.
with ivermectin
I mean, there was a
specifically.
time, I think it was in the maybe 90s, early 2000s, where we were like testing for this gene mutation. And now we know we don't have to do that. We can if we need to treat for other things, but we don't have to do that for prevention.
Okay.
It's so small.
Good to know.
Yes. Okay, what
Okay.
else? What else did we say we would talk about? We never really prepare for these. This is all unscripted.
Well, I think, okay, so something else I've heard you say is for people who are not doing prevention, because we do have people who really are trying to be minimal. And this is an area that we can kind of move that bar without too much risk in Boulder County.
Yes.
Again. But
Yes.
they do travel. So when they're traveling, the medication or the preventative reaches backwards,
Yes. Oh my gosh.
right?
That's
And not
so
forward.
important.
So
Yes.
so talk about that.
Okay, so when you're giving the HeartGuard, ivermectin, whatever product you're using, it's reaching back the last 30 days. So it's killing any like baby infection that's there. So that's how heartworm prevention works. And so if you travel, don't just give it before you travel, go travel and then think you're good for the next month. It reaches back. And so if you've traveled, then do it after you travel, depending on how long you travel. If you're traveling for months, just keep doing it throughout, but don't stop until you've reached that travel with the 30-day reach back. Does that make sense? Did I say that in a way that makes sense?
Well, I understand it, so I'm not a fair person to,
Okay.
to ask. I have people who can say that was confusing.
Yeah.
What I heard is if you're traveling for 30 days or less,
Yeah.
then, and you had not given preventative before you left, give it when you get back because it can
That-
reach back 30 days.
That's
But
right.
ideally, you give it before and after and during.
Yeah. I mean, depending on depending on
But
what
the
you're doing.
before is only going to reach back 30 days. So
Yeah,
if you
the
give it before your trip, you're actually just treating anything that your dog was exposed to before you left for your trip.
Yeah.
And then if you're giving it while you're on the trip, you're just constantly going back 30 days.
Yes.
I maybe just made it all the more confusing.
I know. So yeah, just keep giving it until you've reached back 30 days enough to to cover your travel.
Yeah. Okay, well, here's another question. We don't really
Yeah.
talk about heartworm in cats.
We don't because they're more resistant. And so we think they get it less, but they do get it. So here in Boulder County, we had a barn cat that sadly passed away. And I did a necropsy or an autopsy, and then I sent the heart in, and they were convinced this cat probably had heartworm disease, but I don't know where the cat came from. And so I don't know if that cat picked up heartworm disease in Boulder County. They didn't find any adult worms, but they suspected. So I don't know. It's possible that the cat didn't have heartworm disease and the pathologist was wrong, because sometimes we're just wrong. But cats can get it. They tend to clear it on their own, but it can be fatal for kitties too. I have to admit that I have never given any cat of mine heartworm prevention. I definitely won't be giving my indoor cats heartworm prevention. Not because I don't think it's safe, but just because I would not choose to spend the money on preventing it in Boulder County. But if you have an outdoor kitty in Florida, I think it's worth doing. Because once again, it's just ivermectin.
Right.
Just do it.
But there are different preventatives than ivermectin. Is that correct?
Yeah, I mean, you can use other things like moxidectin, but yes, but I
Because
think
some of the multi that are doing
yeah,
not just heartworm prevention, but they're also doing
flea and
external parasite
Yes.
preventions. They use a different formulation.
right. So they would use. I mean, I think most of those have something like moxidectin in there for the heartworm prevention piece. And I'll say it again at the end, but if you want to learn more about how I manage flea and tick prevention as naturally as possible, I have a course that you can get for free if you listen to this podcast. And so if you go to boulderholisticvet.com and you go to the courses, and it's called, what do we call it? Parasite prevention in dogs and cats.
Yeah,
I think it
it
was
has
like
a
the
really long name, a holistic approach to the creepy crawlers.
Oh, okay.
But on the main page, it'll say flea and tick prevention to
Yes.
simplify what people are looking for.
And if you use the code Truth Tales, TALES.
Oh, TAILS.
Oh, I thought you made it both.
Oh, I think I do. I put it in there both just in case.
Yes.
In case somebody spelled it wrong.
TAILS or TALES. So
Yeah.
just type in Truth Tales, however you want to spell tails. And then you can get it for free. And then, because that's a whole conversation about
really
if
is.
once we get into ticks and fleas, which we should do, we'll do an episode on that at some point.
Yeah. So heartworm. Okay. Are there more things you want to talk about?
Let's see.
We
Okay,
didn't
we've
do the
talked.
life cycle.
That's okay. That's science. You
Okay.
can get on the American Association of Heartworm. Wait, what's it called? American Heartworm Association. I was like, I'll just get those words together somehow. And then you can look at the life cycle of the mosquito. But here, the other thing I really want to say is even if you live in Boulder County in the summer, I'm really recommending prevention. I'm really nervous about the dogs, especially that are my patients, that are going to turn up heartworm positive. And those are going to be the dogs that make us realize that we do have it here and they can get it here. And I feel very protective of my patients. And so just do it. Just do it. Just do it. I don't want it to be your dog.
Yeah, and I would say because once they are heartworm positive, there's not much holistically that we can do.
No.
And it's not a fun process for the dog or for you.
It's
just
pretty awful.
not just from the medication standpoint, but from the non-exercise induced, just, I don't know,
All the
kenneling
crate.
them.
Yes.
Yeah. And asking active dogs that want to be active still.
Yeah.
Because it's a heavy load on their heart. It really is.
Yeah. So just prevent it. And I know, like, even if you're so holistic and natural, I get that. And let's keep doing that. Let's be natural. You can feed all the things that you want to feed and do all those things, but like just prevent it. I'm nervous. I used to not care about heartworm prevention. I didn't care at all, but now I'm like, oh, just in the summer, just a few months out of the year. Let's do a little.
Yeah, that is the
ivermectin.
holistic approach right there. Prevention is a holistic approach to heartworm. That is what you're recommending.
Yes,
So,
just do it.
yeah.
Okay. Okay, I think that's it. Go grab that course because we do talk about heartworm prevention in that course. Use Truth Tales. You can get it for free.
Wonderful.
Okay. We want to hear from you. So leave a comment wherever you're listening to this. Have we decided that people can leave comments anywhere?
Well, I know on Spotify there are comments. YouTube, there are comments.
Yeah.
You are supposed to be able to leave comments on Apple, and I just haven't. Okay, I'm working on the SEO stuff.
I know
And
we're
learning how to upload and all the non-nursey things that I'm doing.
we're just veterinary professionals podcasting
Nurse/tech.
with no help. We're just doing this by ourselves.
Yeah, so if you learn how to put a comment, we would love to hear. We'd love to hear.
Yeah. Then send us an email saying, "Hey, I put a comment," or maybe that'll notify us.
It. Yeah,
We don't
maybe
know.
they exist and I haven't found them. So I'm so sorry if I have not responded.
Okay. We will see you next time. Bye.
Bye.